I'm Jashandeep Kaurtwana. I'm 12 years old. I have diabetes type 1. I came to this little camp thing to get rid of my insulin that I have because I'm type 1 diabetes. And within these 3 days, I have now achieved of losing the insulin. I'm not on it anymore. And I recommend any of the people who's out there who has diabetes and who wants to get rid of their insulin as well and be free, I would recommend you to come here.
Hello, my name is Rafiq. I'm from Singapore. I've been struggling with diabetes for somewhere around 15 years, and I've been on medication. Started off with just tablets, then the doctors just increased it to a higher maximum dosage of insulin, injecting insulin. So I was always looking for some natural way to cure myself because I know that it exists. But then I was not getting the proper guidance. Then happened to see Dr. Biswar's video, and then it really connected with me. So when I heard that they were having the course in Johor, immediately I signed up for it, and I came, and I've been before this I used to have vomiting when eating, but now even though in this course we eat a lot, I don't have that vomiting problem anymore, and I think my sugar is also coming down. So all those who are diabetic, they should definitely try out Dr. Biswar's course because it goes back to nature, and only nature can cure you fully. Medicines they lead you down to a more dangerous path. So whoever has a chance to take up Dr. Biswar's course or listen to his videos and get his advice, please follow it.
I'm known as Brother Wong from Singapore. I'm 75 years of age. I came here just to see what's the course like. Basically, it's meant for my granddaughter who is 2 years old, having diabetic type 1. This course has given me some insight into what to do and helped me how to calculate insulin plus or minus when we are high or low with the GL level. I find this course useful and packed with a lot of information. So it's good for those who can afford to come. Thank you.
Hello, I'm Hadid from Singapore. Yeah, I came here to the residential tour camp. It's because I wanted to get myself treated for my diabetes. And I also want to free myself from the 3Ds, which is the drugs, diseases, and doctors. So far the camp is very efficient. And yesterday when we came in, we had some orientation. So this morning when I came down, my blood sugar check was 19. And after 2 hours after breakfast, about 2 hours later, then when they checked, the sugar level was about 22. And in the late part in the afternoon, when they checked, it was about 18. It went down to 18. And after dinner or before dinner, when the check was done, it actually shot right down to 10. So I'm happy with it because I think it paid off the whole day, whatever we were doing together as a team. And I am very confident that for the purpose that what I came here for, it will be fulfilled. Yeah, and I want to thank Dr. Biswaroop and all the staff here and all of us who are at the camp here, that we accomplish whatever we came here to do, and that we will carry on and maybe pay forward to others to share whatever we have learned here. Yeah, thank you.
Good evening. My name is T. Selvin Subramaniam. My background is I am a nurse and I work in a private hospital. And I have volunteered to join this program. So today we started off in the morning by not taking our medications at all, both the hypertensive drug and the diabetic, insulin. And we are guided by Dr. Biswaroop. I was a bit worried, in the morning because I started off with, after taking my breakfast fruits, my sugar was 16 millimoles. And but I have also the monitoring going on where the scan is fixed to my hand. So towards then Dr. Biswaroop sort of gave us the motivation that no, just let's see what's happening. And my blood pressure was 160/75. So we continued, and then we had our lunch, and then after the lunch we came back in the afternoon to monitor again. My blood pressure dropped down to 145/70, and my sugar was 13 millimoles. I was feeling a bit happy because the whole day I have not taken my drugs, and my sugar is within the range that was actually recommended. There's 14 millimoles. So that gave me the confidence to continue, and I'm going on fine. And I'm just waiting for the third day to see the outcome of this program. I have a lot of confidence that this program will work for me. I have been a diabetes for 20 years and taking the insulin. So I'm excitedly waiting for the day to come, the third day. Thank you very much.
All right, my name is Yashu Whelan. I've been diagnosed with diabetes in 2014, December. I was in denial for a while. Then I tried, the Claude Elstein's diet, which helped Bill Clinton. I did it for 7 days, and I lost my weight. My blood sugar was normal. Well, after the 7 days, I don't know what to do because it was a Western diet, so I couldn't continue with it. And then my son saw Dr. Biswaroop in YouTube, and so I started his diet as well. And I did lose the weight, and my blood sugar came back normal for 3 days. And after that, I didn't know what to do with it because I didn't have the diet to proceed. And then I tried to come here. This is why I'm here, and I think I have a better understanding now, so I am going to stick to it. And I'm not going to take any medication. I know I'm going to have a tug of war with my doctors, but I'm not going to tell them. I'm going to take the medication and keep it in the house like what Dr. Chowdhury said, you see. And I was going to check for about 6 months, see my blood sugar is normal and all. Maybe later I might tell the doctors about it. Thank you very much.
Over the past 2 years, I realized that my blood glucose readings were increasing slowly but surely. And I felt very helpless because no matter how much I controlled my food, I couldn't bring it down. It got to a stage where I became pre-diabetic, and I started looking for alternatives. And I stumbled across Dr. Biswaroop Chowdhury's videos, diligently watched them for almost a year, and managed to contact his people and come for this residential training here in Johor Bahru. And I was a bit apprehensive in the beginning, but today, the final day, I feel so good. It's trained me to relearn how to eat.
Yeah.
Like I've been eating in one way. It sort of taught me what I need to do, and it's also given me a boost of confidence. And I'm really looking forward to going back and trying out the delicious new recipes. And I'm just glad that I made so many new friends here. So thank you, Dr. Biswaroop and his team.
Hi, the courses was so beautiful, so exciting, and so fulfilling, as if to the heart. I have no words in my mouth to describe how beautiful the course was. We had lots of friends, lots of fun at the same time, and we really enjoyed Dr. Biswaroop Roy Chowdhury course which he gave. And I'm looking forward to it to be as enjoyable as it has been today. And I'm looking forward that this work for us and Dr. Chowdhury get more and more customers. I will try my best from my part to bring as many customers as I can from Mauritius to join the program, because I've seen myself how exciting and how beautiful it is. Let's see the result, and we'll look forward to see you soon in Malaysia in March. Thank you.
我是吴挺玲，我才来参加这个72小时帮我们能够转换血糖，帮糖尿病者恢复他们的血糖值。我本身是没有糖尿病，我是因为我身体上有一些疼痛，因为我们的生活在我们不留意当中有很多一些那些毒素导致身体上的疼痛，然后经过这个3天的过程中，我的疼痛肚子的疼痛一天一天比减少，然后医生也介绍我们怎样在吃饮食方面吃的就是吃把蔬菜水果吃多的那个方式，让我们的生活让我们的身体健康提升，然后怎么样去平衡我们的血糖和我们生活的素质谢谢 ，Thank you.
Hello, I'm Syed Jamil bin Syed Agil. Yeah, I was curious to find out the real cure for my diabetes. Like others, I tried supplements, other kind of medication, but it sometimes works and sometimes doesn't work. So I do not know what is the problem really with diabetes. So I guess a clearer picture, clearer answer to all my anxiety. And now I think I am better equipped with the knowledge to tackle my diabetes. Thank you.
Well, I'm Jante, and I've been a diabetic for the last 20 years, and I am on insulin 100 units. And in fact, I saw Biswaroop's TV video program just by chance on the TV a year ago. After that, I started following the program on my own, hardly maybe 50–60%. But even that did help. But what I got the results in 3 days here was just amazing. Just in 3 days, I did so much more than the 1 year, which I couldn't achieve. You know, I've achieved so much. I can even walk. I can even climb the steps. Before that, I couldn't climb steps. Just in 3 days today, I climbed steps so many times. I'm so happy I came here. Getting so emotional. And my blessings and prosperity, best of health to Dr. Biswaroop. And a big thank you. Hope he'll be always healthy to help many, many other people. Thank you, doctor.
Thank you. My name is Frank, and I've been a diabetic patient for 4 years. And with this diet, I'm completely cured now. Thank you.
I'm very glad to have attended this program to get to know the participants from Mauritius, Singapore, and Malaysia. So far, my blood pressure, when I was dependent on several treatments, now I went without. So far it seems very working very well. And the other thing is that regarding the diabetes, I'm reducing the dosage because of the food I've been taking. I hope it will improve. And I hope that the blood pressure also will not deteriorate. Yeah, and thank you.
Good evening. I'm T. Selvin, a healthcare professional. I have with me here a world-renowned medical nutritionist, Dr. Biswaroop Roy Chowdhury, all the way from New Delhi, India. He had just completed the 4th successful diabetes residential reversible tour program in Malaysia. We have during this program both local and international participants, where they came all the way from UK, Australia, Mauritius, Yemen, Singapore, Dubai and India. I'm very honored and privileged to interview Doctor immediately after the 4th program to give the audience a clear picture of what's happening. Doctor, good evening, Doctor.
Good evening.
Can I ask you, can I start the questions?
Sure.
Yeah. My first question to you would be, Doctor, what is your vision, mission and goal towards the growing epidemic, diabetes?
Yeah, the mission is very clear. That is freeing the humanity from 3 Ds: drugs, diabetes and doctors.
It's very clear. Can I go on to the next question? Your approach towards treating this condition is not congruent with the conventional methods of prescribing drugs. What led you to such a decision or a program or a method?
Yeah, I can make it very simple. Let me simplify for you and for the audience as well. The moment we say diabetes is a disease, that is a conventional approach, and disease should be treated with some medicine. But if you see the medical literature, it is not classified diabetes as a disease, as an illness. It just means high level of the sugar in the blood. So it is not a disease at all. It is not classified. So if it is not a disease, so there is no question of treating it with the medicine. Right. So there lies the basic difference. Yeah. We have to cure a disease with the drug, but something which is not a disease, why should we cure with the drug? Anybody who is a diabetes patient, it is not because of the drug deficiency. So because of lack of some drug, some medicine, he got that. So if it is not the lack of medicine, how a medicine, if I pour in the person, it will help in the cure.
So your basic principle is that diabetes is not a disease, it is just a high level of sugar in the bloodstream.
Yes, as simple as that.
Right. I'll go on to the third question. There are 2 parts to this question. Can all complications related to diabetes be reversible?
Yeah, actually it is all about reversing the complication first, and that leads to the high blood sugar coming back to normal. For example, if somebody is having a high sugar in the blood, the cause can be the resistance of the skin or the fat, insulin resistance what is called, or the cause can be the pancreas is not producing enough insulin, or the cause could be there can be some tumorous growth in the pancreas, or the cause could be the person can be too obese. There can be many causes, right? So addressing the cause is the answer.
Right. So having said that, Doctor, I could go on to the next part which says that how strong is your take on this underlying principle? Is that what is guiding your program?
What kind of principle are you talking about?
What just now you said that it is diabetes can be is reversible. The complications are reversible, and you gave an explanation to that. Is that your underlying principles and guidelines guiding you on your program?
Yeah. All the body, it is made up of cells. Millions of cells we know, and every day thousands of cells die and thousands of new cells formed, right? And when any organ functions less than optimum, this means some part of the cells are already dead. Right? But as we understand that cell can revive, new cell can generate, if we give a right condition to the surrounding of that body part. So that is all about the cure. So curing the underlying condition, curing the part, the high blood sugar led to certain kind of condition, reversing that condition will also reverse the high level of sugar, it will come back to normal.
Right.
So that is right.
Thank you for this clear explanation. Could I ask you the next question is, the ACP guideline which you are aware of, Doctor, which came about in 6th of March 2018, do you agree with the 4 statements in the ACP guideline? And does it support your vision and mission?
Yeah, ACP guideline, as you know, it came on 6th of March 2018.
Yeah.
But in line with that guideline, we released a book called Last Days of Diabetes in 2015.
Right.
That is 3 years back.
Yeah.
Where we stated that any blood sugar under 14 millimole per liter should be called as normal.
Yeah.
We stated much before that, as much as 3 years before that. So now the guideline, which is now very official, ACP guideline, that American College of Physicians guideline, it says that
roughly about 244 mg per deciliter, or roughly about 13.9 millimole per liter. It is very close to what we have predicted, what we have already proven 3 years before what ACB guidelines, before the launch of ACB guidelines. So, and second thing, we already used to tell our patient, it has been about 5 or 6 years, that the drugs can control or lower the blood sugar, but drugs cannot cure you. In the process of controlling the blood sugar, making it down, it makes you even more ill. So high blood sugar is bad, but trying to reduce it with drugs is worse.
Right.
So this we have been advocating, educating our patients for last 6 years or so. And ACB guideline, the first guideline, if you read, it says the same thing. It now discourages the doctor from prescribing medicine. Only in rare conditions, that too for a temporary period, the doctor should prescribe the medicine, that too with a lot of care. So this means the kind of protocol which we used to follow in this guideline very much goes with the same protocol. So now with this guideline become official, it is one more support to our mission.
So awesome. I'll ask you another question, which is a bit emotional. What can you say to cancer patients who, upon newly diagnosed, they sort of lost your hope and they feel that the world is coming to an end for these people? So, what is your take on that?
It's something, cancer is can be very, very interesting. One should not be fearful, scary about cancer. So the very thought of cancer, it brings a lot of fear and tears among the people. A kind of phobia, cancer means death. But the truth is, like diabetes, cancer is not a disease. Cancer just means that some of the cells, they start multiplying too much, more than the normal speed. That is cancer. And interestingly, each one of us, including me, including you, we are at any point of time having a lot of cancer cells in our body. Right? So, but those cancer cells, they grow to a certain extent, then our body overpass. That's how it is. So rather, not having cancerous cell can cause early death. Right? So cancer is not something to be feared of, but the knowledge, how it spreads and how we can control it. If you can understand it, then you understand that you don't die of cancer, you die of cancer medication, cancer treatment.
So, in this conversation that we are having, this interview, then can I safely say to these 1,000 viewers who are watching us that the take-home message would be that food should be plant-based and also consumed in its natural raw state, so that we can eventually witness a total eradication of the lifestyle disease?
The very sentence, lifestyle disease, if you see very closely, lifestyle, you have a style in your life. Your style is a eating style, living style, and that style is causing a disease. The moment you change the style, the illness vanishes. And now if you talk of Kuala Lumpur, if you talk of New Delhi, if you talk of Ho Chi Minh, if you talk of Dhaka, wherever I have my centers, everywhere the lifestyle is same, exactly same. That is trying to be too dependent on processed food, trying to too dependent on something which is bottled, something packed. And no surprise that in these cities the disease is, prevalence is almost similar. Diabetes, heart disease, cancer. So what we do, we change the style of life. The moment we change it, body gets the right nutrition, and within a matter of few days, I'm not saying few weeks or few months, within a matter of few days, the person starts reversing the symptoms, reversing the total blood homeostasis, and that is just like miracle. But every time it happens, human body is like a miracle. So even if the person is suffering from last several years, it may take few days if the person is on a right nutrition. And when I say right nutrition, it just means a plant-based diet.
From your explanation, Doctor, which is so intense, what is that which is stopping a lay person who, say, for example, is a cancer or a family of a cancer patient, to stop them from believing or trusting in what you are saying? What is holding them back? What's the obstacle?
That is a lack of knowledge. Human beings are not the intelligent being. Human beings are emotional beings. And emotion doesn't go with logic. Emotion how you develop emotion? When you see certain kind of things again and again and again. If somebody keeps on repeating certain thing to you, you find an emotion in it, right? So since childhood we have been seeing all around that there is no solution for cancer, there is no solution for diabetes. So when we see a lie several times, brain labels that as a truth, right? Brain labels that as a fact, and that is emotionally attached without logic.
Right.
Just repetition makes us believe that this is true. However, the kind of science which I am talking about, evidence-based science, that is a plant-based diet can help you reverse a disease within a matter of few days. But however it is true, it has been proven, but it is never been repeated among the humanity, among the public, because the media is playing a role. Media repeats only those things for which it is paid for, and is paid for by only the drug companies. So the drug companies want to believe that one can save their life only through drug. There should not be in the media.
Well, Doctor, it was a very wonderful opportunity to be with you. And we as a whole, population of Malaysia as a whole, we would pray and hope that all your visions and come true, and that diabetes will be eradicated and will be a free diabetic world. Thank you very much.